If you come to Bendigo Health for a surgical procedure, you can be assured you are in the very best of hands. Our friendly team of nurses, doctors and administration staff are part of the community you live in and are connected to what matters most to you. The surgical team provide high-class, safe and supportive care, ensuring that every aspect of your health is managed with exceptional quality right here in your community. When you arrive at Bendigo Health on the day of your surgical procedure, we recommend you come into the hospital via the multi-deck car park, which can be accessed from Lucan Street. From the multi-deck car park, you may enter the hospital via the pedestrian link bridge. Once inside the main building, take the lift down to level 1 or use the stairs. Look for the sign that says Day of Surgery Admissions. When you come through the doors to your right, there will be a ticket issuing kiosk. To use the kiosk, you need your Medicare card or letter from the hospital with your admission details and a barcode. The kiosk will ask you to confirm your personal details on the screen. One of our friendly receptionists will be there to greet you and help if required. The receptionist will confirm your details and then let our nursing staff know you have arrived and are ready for admission. You can take a seat in our waiting area until the nurse asks you to come into one of our consulting rooms for your admission. We try not to get you in too early for your admission, as we know waiting can sometimes be the hardest part. Our surgical team supports the entire hospital and sees a variety of emergency cases throughout the Loddon Mallee region on any given day. This means that on some days, the team may need to change the order of certain surgeries based on how urgent they are. If this change impacts you, our team will advise you of any potential delays to your procedure. We understand that coming for a surgical procedure can be an anxious time. It's important to understand that these feelings are normal. Our theatre complex is a safe place, and our team will be a reassuring presence by your side throughout your surgery. Our well-trained staff care deeply about all of our patients and strive to provide the best care possible. Please ask us questions and explain any concerns you may have. When it is time for your admission, the admission nurse will take you to the consulting room and ask you a number of questions, including your date of birth, your address, whether you have any allergies, and what procedure you are having. You may be asked to repeat this information at various stages throughout your time with us. This is to ensure we provide individualised, safe and high-quality care. The admission nurse will also record your vital signs, your pulse, blood pressure, temperature and respiration rate. The nurse will also measure your height and weight and take your blood glucose level if you are diabetic, while also checking your consent form. An identification band with your name, date of birth and own unique hospital record number will be put on your wrist and ankle. This is the perfect time to ask the nurse for travel forms and medical certificates if you require them. During your admission, the surgeon may attend and use a marker to confirm the surgical site. After your admission, you will be asked to return to the waiting room. Our staff will keep you informed of when you are likely to be taken into theatre. When it is time for your procedure, you will be taken into holding bay, where you will be asked to change into a gown, a hat and booties. Some patients will be dressed in special socks to help with circulation while they are asleep. In holding bay, you will be asked to lie in the bed or sit in the chair beside the bed. Other members of the surgical team, like the anaesthetic nurse and the anaesthetic doctor, will come and see you before your procedure. From holding bay, you will be transferred to the anaesthetic room or into the operating theatre. The anaesthetist will ask you questions and prepare some medicines to help you sleep through or relax for your procedure. Some procedures are carried out on the bed trolleys that transport patients. Others are performed on the theatre bed. When your surgical procedure is complete, you will be taken to the recovery room, where you will be cared for during your emergence from the anaesthesia and medicines you have been given. When you are awake and comfortable, you will be taken back to the ward or onto day surgery, where we can help you get dressed and have something to eat and drink. Here, we check the doctor's post-operative orders and directions for you. and we send off any prescriptions to pharmacy and arrange your follow-up appointments. If you are a day surgery patient, we will get you home as soon as it is safe to do so. We need to gather and complete all of your information and the doctor's orders, as well as assess you, to ensure you are well enough to be discharged home safely. Your support person will be contacted by our nursing staff to let them know when to pick you up from hospital, as you are not allowed to drive within 24 hours of a procedure. We will ask your support person to come to day of surgery admissions reception, where we will take you to meet them when they arrive. All patients having sedation or anaesthetic will need an adult to take care of them overnight after they are discharged from hospital. Our surgical team is continually looking at ways to improve the quality of our service. After your procedure, feel free to provide feedback about your clinical care and patient experience via the Bendigo Health website, bendigohealth.org.au/feedback.